Well, I think we're going to start. It seems like many of us have already joined, and I'm sure we'll have a few others coming in the next few minutes, but with, paying attention to starting on time, I'd like to welcome you to our first virtual Surviving and Thriving Women Cancer series. Thank you all so much for joining us this evening. I'm Dr. Darlene Gibbon. I'm the Medical Director of Gynecologic Oncology at Summit Medical Group Cancer Center. While we would have loved to all see you in person for our annual event, we had to go to our appropriate social distancing techniques, and so that's why we're doing this virtually, to keep all of us safe and healthy. We are going to have 2 talks planned for you this year that we will be performing virtually. Our next talk, which is Nutrition for Optimal Immunity, will take place on October 21st, and we invite all of you to join us for that event as well. For this talk and for the privacy of our attendees, we have turned off all microphones for the attendees. If you have a question for me or for Dr. Nickel, please submit them in the chat function, which you can access at the bottom of your screen. To open that window, if you just move your mouse down, you'll actually see it pop up, and you can click on chat and then type in your message, and you can, and within that chat function, we'll then be able to respond to you. You just need to change your setting to all panelists, and we'll address those questions at the end of the presentation. We're also recording the presentation and plan to share this video on our website and social media channels. If you know of anyone that had to miss this evening that would be interested in viewing it, please let me know or them know, and they can access it through these other links. Finally, we're interested in your feedback regarding our talk this evening, so please look out for the survey link when you exit this presentation. Now, I'd like to introduce you to our presenter, Dr. Elizabeth Nickel, manager of SMG's Integrated Behavioral Health Department, who oversees the clinicians providing face-to-face or virtual integrated and collaborative behavioral health services in primary care, pediatrics, and oncology. She has clinical expertise in depression, anxiety, insomnia, adjustment to various health conditions, grief, weight loss issues, relationship conflicts, work issues, and stress management. Dr. Nickel is a support group leader for Summit Medical Group breast cancer patients who are managing issues of survival, and her support groups include counseling, resources, and referrals. It's a great pleasure for me to be able to welcome Dr. Elizabeth Nickel, and I am looking forward to her talk tonight, Building Emotional Resilience for the Cancer Survivor.
Hi, everyone. As Dr. Gibbons said, I'm Dr. Liz Nicole. Please call me Liz. And I'm so excited to be with you tonight because this is such an important and crazy time for all of us. And to be a cancer survivor during a pandemic is extremely difficult. And it was wonderful for me to think about how I was going to bring together these 2 issues to talk about them with you tonight. So in terms of, oh, and my page down is not working all of a sudden. That's not good. Let's see. It was working when we warmed up. Okay, let's see. I'm going to stop the share, Elise, and I'm just going to then take it back. And let's see what happens. Okay. Now my slides are not advancing.
Okay, it advanced a second ago. So
all right, let's go back.
Just try one more time.
There we go.
Yep.
Sorry for the delay, guys. Okay, so we'll go through a quick introduction, and then I'll talk to you about the link between cancer and trauma, which I feel is extremely important. I try, when a patient is newly diagnosed, to sort of warn them of this early on. Talk a little bit about the pandemic and why for cancer patients this has been particularly difficult. Even if you're a survivor of quite a number of years, you might be finding yourself triggered because of the pandemic. So hopefully we can bring those 2 things together. Survivorship challenges that are certainly there even when you've gotten through cancer, but again, become a little more difficult during these last 6 or 7 months. Then we'll move to all of the positives. So the resiliency, the post-traumatic growth that we can all go through, whether we're a survivor before the pandemic, during the pandemic, after the pandemic. And of course, everyone's always clamoring for tools and techniques and strategies that they can use to help them feel better. And I hope that you'll leave here tonight with at least a few that you want to try. Of course, there'll always be resources at the end. All right, so me, next month or in one day, I'll be able to say I'm a 17-year cancer survivor. So I was diagnosed with breast cancer in 2003. I was 29 years old. And at that time, I had chemo, radiation, surgery. I was part of a clinical trial, and I went on a medication after that for a number of years. So during that time, I was also going to graduate school to become a therapist. And I knew right away that I wanted to pull these two things together if I could. So luckily, when I got to Summit Medical Group, I had the opportunity to work in our behavioral health center and became the resident expert at treating cancer patients. Since then, as was said during the intro, we've moved on to grow some, and we have an integrated behavioral health department where I have 2 therapists working in oncology full-time and are seeing patients in addition to myself. I always try to keep a small cachet of my cancer patients. So in addition to therapy with cancer patients, I've done therapy with many family members. I've been leading support groups for 15 years. And I think what's interesting is I've continued to counsel people during the pandemic over the last 6 to 7 months. Many of those patients have had cancer, but lots of those patients haven't. And I'm struck by how many similarities there are, and I'm excited to share some of those with you tonight. So some quick statistics. By 2026, there will be more than 20 million cancer survivors in the US alone. That is a lot of survival, and we need to think about what people are going through after they finish treatment. Not a surprise, I'm sure, to many of you, 18 to 25% of long-term cancer survivors report that they have anxiety. But if we look specifically at fear of recurrence, it can go up to as much as 80%. And I'm going to argue, granted, occupational hazard. I work with cancer patients that have a fear of recurrence, but I really feel that this is closer to 100%. I don't know that I've ever met a cancer patient that hasn't said that's their foremost concern. If we look at post-traumatic stress or post-traumatic stress disorder, and I will tell you a little bit about the difference later on, surveys have found anywhere from 5 to 60% of people could be experiencing this. And if we just call it cancer-related distress, that number can also be a pretty high number, 35 to 43%. Distress can encompass anything. It could be grief, it could be anxiety, it could be depression, it could be anger. So just a large gamut of different emotions that fit distress. If you look at the pandemic, and I was very much struck by this, of course, we don't have data that's up to date as of today, but this was May, June, and July. This was the Kaiser Foundation. They surveyed people on anxiety, depression, or a mix. So look what happens May, June, July. Anxiety, depression, and anxiety or depression increased over that time. I believe that if we looked at August's numbers, and now that we're rounding out September's numbers, we will find that these numbers have continued to increase. I think even more so as schools tried to get started and people thought this would be the moment in time where life returned to some amount of normalcy, and that hasn't happened. I've seen people who were coping fairly well become quite distressed in these last 30 days. So I think these numbers, are true, but I think they're even higher now. So whether we're all collectively healing from a pandemic or we're healing in that we're cancer survivors, emotional and physical recovery allows our emotions to be all over the map. And I love this graphic because there are positive emotions in here. There are also some of the more distressing or negative emotions. So in the same day, we can feel joyous and we can feel lonely. In the same day, we can feel hopeful, but we can feel really heavy. Sometimes things feel messy. And I think right now, again, regardless of what you're going through in your life, the world feels kind of messy and we're all trying to make sense of this. But then throw recovering from a cancer diagnosis and potential treatment, it gets gray in terms of where you might be on any given day. So when you were diagnosed, and again, I know I probably have people here that are in active treatment and were recently diagnosed, and there could be some people that, just like me, this was many years ago, but you see there was this wide array of emotions that took place at that time. Everything from shock, fear and anxiety, anger, disbelief, sadness, grief and loss, guilt, loneliness, an overall loss of control, and I even had to throw relief on there, which may seem like an odd one, but I've had enough people tell me that they had this sinking sense that something was wrong with their health for a period of time, and it just took a while to get to the bottom of what was going on, but when they finally got a diagnosis that they could do something with, they actually felt a sense of relief. So let's think about post-traumatic stress, the syndrome versus the disorder. Obviously, it encompasses anxiety. It's brought on by a traumatic event. Think of what most of you think of when you hear PTSD. We think about soldiers returning from war. We think about survivors of rape. We think of people who have been victims of crime, right? Some sort of traumatic event where somebody believes that they could lose their life may result in this post-traumatic stress syndrome or disorder. So again, think about this for a moment. We can all remember that moment that we were diagnosed with cancer. Some of you were in a doctor's office. Some of you may have been on the phone with a doctor. More recently, some of you may have been having a video visit with your doctor, and you were told that you had cancer, an illness that could kill you if you did nothing at all about it. I'm always going to argue that moment is just as difficult for our mind to understand as being held up by gunpoint in a train station late at night, right? For a moment in time, we were told that we could die. So what are the symptoms that happen in either the syndrome or the disorder? Well, you relive the event, you think about it often, certain things will set you off. You may avoid situations that are reminders. Some of us might have trouble sleeping, have intense feelings of fear where we don't necessarily think, oh, I'm worried about getting sick again, but we just feel really on edge and irritable, crying out of nowhere for no apparent reason. Having difficulty in relationships. I think the 3 cancer patients I'm working with right now are all struggling in their marriages. Sometimes being irritable on one end, other times feeling like you're numb and you've got no emotions left. You might have trouble concentrating and focusing, difficulty remembering key details, and even some negative changes in your beliefs and feelings. And what I mean by that is all of a sudden you may find yourself thinking something like, bad things always seem to happen to me, or I can't really seem to turn things around. Now, hold cancer for a second and let's just talk about the pandemic. There are many similarities across normal people's experiences right now during this time that as you're talking to people, you may even find yourself saying, wow, this kind of sounds like what it was like when I was diagnosed with cancer, right? So shared similarities, a lack of control. There's constant changes, there's constant updates. I'm sure many of you have felt that there are days that literally from hour to hour, things change and it's hard to keep up. There's a sadness. There's a lack of motivation and drive. Again, many of us saw the articles where at the early stages of the pandemic, it was, you know, I'm going to clean every room in my house and I'm going to donate all of the clothing to Goodwill and I'm going to get so much done. That's really changed over time, and lots of people now are describing to me difficulty getting a whole lot of anything done. We've lost activities. Some of us have lost work. Many people are unemployed. There's an increased fear, anxiety, and worry as an entire nation at this point in terms of what do the next couple of months look like and what's going to happen to my health or my family's health. There's uncertainty about what's safe. Right? So again, lots of conflicting information and info out there, and it's hard to process and always know what is the right thing to do for you. We might have grief. we've lost a lot of things that we used to be able to do, as simple as having a meal with our extended family. Sometimes we use poor coping strategies. It's not uncommon for people to be making all kinds of, comments on Facebook and things about maybe they've gained a couple of pounds, maybe they're drinking a little bit more than they should. This is a time where we're trying to find comfort, and oftentimes we turn to things that are maybe not so good for us. We might feel more lonely and isolated. We could be nostalgic about what life used to be like way back before the pandemic. Lots of people are describing an overwhelming fatigue, even when they're sleeping 9 or 10 hours at a clip, feeling really vulnerable. And I think what's very distressing is it's a topic of constant conversation. You cannot get away from the pandemic right now. If you're on social media, if you're on Facebook or Instagram, if you turn on the TV, if you even turn on, in some cases, a movie, it seems like they're rerunning all of the movies that used to play about pandemics and contagious diseases. Everyone is living this, and it's a topic of everyday conversation. So now let's think about survivorship for a second. And I'm again going to argue that these issues that survivors face, it doesn't really matter if you're a survivor of cancer, if you're a survivor of COVID-19, perhaps even just surviving this pandemic, even if you remain healthy. Emotions are really confusing. And the toughest time for people is actually when they become a survivor, right? So it is not uncommon for patients to contact me to come in for therapy when they've completed treatment. Maybe it's a month or two after, and they're not quite feeling right. And a lot of people in their lives have gone back to what they need to do, and they're feeling really, really scared and really lonely. I'm going to argue, as we all survive a pandemic, once things start returning to more normalcy, whenever that may be, all of a sudden people may notice, wow, I am changed. Things are different. I don't feel the same anymore. So I'm going to say, if you get through a pandemic, you've survived in some way and might experience many of these too. I think what happens is that there's a gravity and a heaviness to saying, wow, I just lived through this. I was just having a conversation yesterday with a patient who said to me that their experience of surviving cancer is very surreal. They look back at all the treatment that they did. This particular person had radiation, many months of chemotherapy, several surgeries, and they don't even really remember living through it. And it almost feels strange to say I did that, because it's your brain trying to protect you, right? We don't really want to have crisp memories of all that we went through. And when you realize what you survived, you can feel like you're on a deserted island by yourself. Not everyone understands what you've been through. And if you don't have anyone immediately in your life who is also a cancer survivor, or maybe a friend who's a cancer survivor, you might feel like you're on your own. I have now started to hear those that have survived COVID-19 also saying that they experienced the same thing, which is it's hard to relate to other people. So you're trying to return to a life that the new you doesn't quite know how to navigate. And we'll talk about this a little bit more tonight. Your wants and needs may have changed. Even in terms of cancer, some of your abilities may in fact be different. There could be long-term side effects and obstacles. And again, with COVID-19, survivors of that, I was just reading an article this week talking about the syndrome that survivors of COVID-19 have, physically and mentally. And finally, there's a fear of recurrence that doesn't go away. It doesn't matter if I'm at 10 years, at 12 years, at tomorrow, 17 years, I still worry about this, and it's the number one fear in my life. You continue to adjust to a role as a survivor. Everyone is different. Some people want to scream survivorship from the rooftops and, try to incorporate it into their lives in some way. And other people who are more private kind of want to return to a life and not really mention it, or mention it as little as they have to. The thing that really has changed is that most of us are going for regular doctor's appointments. We're going for scans, we're going for checkups, and these can be incredibly stressful, because think of your traditional viewpoint of post-traumatic stress. If you were a soldier and you returned from war and you went someplace that looked very similar to where you served, or you heard what sounded like a bomb go off, you'd immediately have a reaction, right? Well, we continue having to go back to the doctor's offices that saved our lives, but also where we got some really bad news and oftentimes didn't feel so great. It is really normal to be stressed out by your doctor's appointments. I can't say that enough. You may also have a potential increase in health anxiety. So, you get a headache and the initial thought that comes to mind is, oh no, I must have brain cancer, or this must be metastases to my brain or something like that. I have done it. It takes me a minute. I think about it. Usually I can talk myself off the ledge, but we've all been there. Overall, the landscape of your life may begin to change now that you kind of move into this survivorship role and you're trying to figure out, okay, now that I lived, how do I want to live and what do I want the rest of my life to look like? A quick list here of additional struggles. These are things that patients tend to talk to me as a therapist sometimes more about than they even talk to their doctors about. But of course, I'm encouraging them always to please tell their doctors what are going on, because we can help you. We just need to know that it's going on, right? So sexual dysfunction, relationship issues and changes, as I mentioned earlier, many people have marital struggles. Sometimes people have difficulties with their children, their adult children, their friends, friends that they thought would have been there for them that maybe were not there. On the flip side, people that they didn't even think of necessarily as close friends who really rose to the occasion and did way more and went above and beyond. Body image issues, depending on what kind of surgery you've had. Certainly mood disorders that result, whether it be full-blown, depression or anxiety. There's been changes in jobs and careers, and in some cases, loss of income because people can't work maybe the same way they used to. Certainly a sense of grief. I think the number one thing I point out to people right off the bat that we're grieving is a loss of naivete, right? Because the day before we were diagnosed with cancer, we got up in the morning and didn't really give our health a whole lot of thought. And all of a sudden then we're diagnosed with cancer, and now it's something that we think about on a daily basis. Some of you may have experienced survivor guilt. We meet people when we're going through treatment, and unfortunately not everyone survives. And here you are, you're here to tell your story, but someone else might not be. And finally, and although this sounds negative, an identity crisis, I'm actually going to say that this is a real positive, and we'll come back to this. So, cancer survivorship during a pandemic. Let's bring them together now. So as a cancer survivor, your experience of trauma is ongoing because, again, you have to go back to your doctor's offices, you have to have scans, you may have scares. I think in my 17 years, I've had about 6 scares in which numerous tests were required before ultimately I was told, okay, we think it's nothing. And there are reminders, right? Depending on what kind of cancer you've had. For me, I was diagnosed in October, and October is about to start. It's Breast Cancer Awareness Month. So, all of the pink things, can be triggering at times for me. But now throw in a pandemic. This has been a really stressful time for anyone just going through the pandemic. But on top of it all, it impacts our sense of safety, right? Well, we were already compromised in that way to begin with, because we're always worried that there could be something else around the bend. Or a lot of people use, I'm waiting for the other shoe to drop. And now we have to worry about catching a virus. Appointments have become more stressful for us. I think certainly if you were scheduled for appointments that normally you would have gone to in March, April, May, maybe some of you had to delay appointments. A few of my patients had to delay their surgeries for cancer, for a period of time. Just seeing people in, all their gear and masks and face shields, it is like we've entered another world. It can feel really scary. There is a possible higher risk to cancer patients depending on how far out you are from your treatment, and your doctor has probably told you if you're considered immunocompromised. So that makes going out into the world a little more risky or scary. This can certainly intensify your anxiety. And we really can't rely on our support system the way that we used to. You know, my mother was my biggest support when I was going through cancer treatment. And there was a period of time in these last couple of months where I didn't see her for almost 4 months. And that was really, really hard. You know, everyone that we need to be there can't always be there. Finally, all problems prior to the pandemic are magnified. So think about this for a second. If you were struggling with your finances, if you were having marital issues, if you were having difficulty with your child's behavior, or a college-age student was not doing well in school, anything that went on prior to this has now magnified. I have very few problems I can think of that people said, wow, this problem I had actually got better as a result of the pandemic, right? So most people are struggling, I think, a little bit more than we were at the beginning. So how do we get through this? What do we do? How do we become resilient? Well, the good news is resiliency is modifiable. So although there's been some studies that say that you're born with some level of resilience, you absolutely can increase it. So of course, resilience is your ability to maintain and also restore good psychological and physical functioning even after a stressful situation. So in terms of cancer, we want to grab onto your protective attributes, personal characteristics that make you who you are, that allow you to really successfully adapt not only to having had cancer, but especially if you've had cancer either shortly before the pandemic or during the pandemic. You know, we want to help you really adjust in a way that may require a little bit more handholding, but I think you'll get a lot of skills tonight that you can try on your own. We also know that those with a higher level of resiliency experience post-traumatic growth. And let me just touch on that for a moment. This is probably my most favorite thing to talk about with people that have been through cancer or any sort of traumatic event. It's a new terminology in studies now, maybe in the last 5 years or so with cancer patients, but this has been used with patients that have been through trauma for many years. 53 to 83% of cancer survivors reported that their lives changed positively after cancer and that they used some amount of coping skills in order to help them get there, right? So what are positive life changes that may happen as a result of something so terrible like being diagnosed with cancer? First and foremost, a change in who you are, right? Self-perception, empowerment. You've survived something really significant. Not everyone can say that. You know, again, many people who have now lived through a pandemic might be saying things to you like, wow, I didn't really get it when you were trying to describe to me what it was like to come through cancer, but I'm sort of starting to understand how difficult it was for you, right? So you are strong and you are powerful, and that might change your thoughts on your abilities. All of a sudden, the impossible seems possible. Change in relationships, it's either relationships improve or in some places you need to lose them. Lots of people talk about toxic relationships they had prior to cancer that once they came out the other side, they decided to end, whether that be a divorce or just ending a friendship or spending less time talking to a particular relative that's distressing. And finally, this is one I think that has gotten some press more recently because of the pandemic, a changed philosophy of life, right? Our priorities are different. We have different goals now. We have a certain appreciation for life maybe that wasn't there before. Some people even talk about things like spiritual gains or having made lifestyle adjustments. I think lots of people that you've seen interviewed have talked about being able to spend more time with their kids, you know, having their kids at home during a time where they might not otherwise have been there. You know, lots of people adopted dogs. I did. I adopted a 10-year-old fairly sick dog in July who has brought me nothing but happiness for the last 2 months or so, and I hope he sticks around for a while. What do we do then? I mean, how can I begin to give you some tips tonight in wake of living still in a pandemic? Obviously, the most important thing is just ask for help. If you are not doing well, talk to somebody. Talk to your doctors, talk to a friend, go online. There are so many amazing online resources. Ask a spouse, ask a parent, ask someone to help. I have been spending an awful lot of time creating calendars with people because our routine has gotten thrown for a loop. And so as a result, we're maybe not doing all of the things that are important for us to be working in, like self-care. So I've made sure with people that we're putting something down every day that's truly a gift just for them. Continuing to find ways to express your emotions, you know, that may be journaling, that may be art, that may be some form of movement. And exercise always comes up when we're talking about mental health, because truly exercise is the #1 antidepressant and anti-anxiety med, let's call it, that we have. And I know when people are coming out of cancer treatment, they can't always go back to that which they used to do before. So it's important to speak with someone to find out, what can you do, even if it's just going for a walk. Find others that have been where you are and that get it. You know, I think, again, right now we're a very interesting group. We've survived cancer and now we're living through a pandemic, and it's been really, really helpful for me to continue seeing cancer patients during this time, because it absolutely helps me feel like we have this community, and I feel a little bit less crazy when I realize that we're all going through something so similar. Take back control where you can. You know, obviously we control what we eat, we control what we drink, we control how much we sleep, we can control if and when we exercise. I mean, these are things that we make determinations on how we do every day that have nothing at all to do with the pandemic. So it's important that you try and engage in some healthy behaviors. Now, what about from the more psychological side? What are some suggestions that I can give? And again, I would encourage you to share these with people who aren't cancer survivors. I mean, they're just helpful strategies. A post-trauma vision board. You may have heard of a vision board or done one before. It's basically a visual depiction of what you want your life to be. So now that you're coming through cancer, maybe it's years since you were diagnosed, and you're looking at your life and you're saying, okay, I still have lots of it left. What do I want to do with it? Especially now that the pandemic has me waking up and thinking about these things. Make a vision board. You can do that just by drawing or painting, but you can also do that by going through magazines, cutting out any sort of images that resonate with you, paste them, and then hang it somewhere that you can see it. I've also seen people do vision boards with a bunch of different words that are meaningful to them, or what, you know, they want to ascribe to be. I've included a link here, and these slides will be available to you after, to help you determine your values. If you've ever done career counseling, you may have been walked through an exercise where you try and determine what your values are. If you're working in a job, for example, that doesn't agree with your values, you're going to be pretty miserable at work. I'm going to also argue, if you're living a life that doesn't agree with what you really value, you're probably pretty miserable. So we need to figure out what those values are and get you doing things that encompasses those values. So here's an example. If one of your values is helping others, but you find yourself right now during a pandemic feeling like you can't help others, you may be feeling really sad, and it's going to require some creativity to figure out, how can you still help others even when you're stuck at home? So there's a nice little assessment here that allows you to look at a whole bunch of values, prioritize them, order them, and I think that will be really, really helpful. Schedule time to both think and worry, but also to laugh. So those things are obviously counterintuitive. In cognitive therapy, the way I'm trained, we use worry time a lot. Worry time is where you set aside a certain number of minutes per day to worry. Anything outside of that time, you write a note to yourself what you want to think about, but you don't return to that note until your worry time. Might be 7 o'clock at night, might be 7 in the morning, but you allow yourself to sit down, cry, be concerned, be anxious, have that panic attack if you need to. And then once your 15 minutes or your 30 minutes is up, next 23 hours, you don't return to your worry. And I think right now we are all worried a lot of the time. And I want to encourage you to imagine that you can, in fact, rein in your worry and decide when you're going to do it. But on the other hand, schedule time to laugh. Everyone should laugh every single day, and I'm even going to argue, do this right before bed. This is something that I actually learned from my husband, and I tell him that I tell others this story all the time. He doesn't like watching the news before bed. I came from a family where all we did was watch the news. So when we met, it took some time, but he got the courage up to say, hey, can we not put on the 10 o'clock news and do something instead? And so even in the midst of this pandemic, I watch him every night as he climbs into bed with his iPad, watch his favorite comedian. Some of these bits I've heard hundreds of times, but he still laughs. I laugh. It's a good thing to do. So return to those old reruns of Seinfeld, watch puppy videos that make you smile, but please find time to laugh every single day, even if you have to find a way to fakely make it happen, if you will. Sometimes looking at the evidence for and against your thought can be very helpful. And, again, that's a CBT strategy, but there's a lot of info available on that online. If you have a thought like, I'm worried that I'm going to have a recurrence, look at the evidence you have for as well as the evidence you have against, and I'm sure you're going to have a whole lot more evidence against, and in the moment that can help you feel better. Sometimes just changing the narrative, like instead of saying, I'm scared I'm going to get sick again, saying, I'm having the thought that I'm going to get sick again. That creates some distance, and it's much less emotional and anxiety provoking. I love that one. That's one I use a lot. And finally, mindfulness, this is a term that's out there everywhere. You can get this for free in so many places: podcasts, YouTube videos, CDs, books. And I always throw people the basic senses exercise. Just tune into your 5 senses. What do you see? What do you hear? What can you smell? What can you feel on your body? And what can you taste? If you can do that in a 30-second format, you are being mindful. You're truly living in the moment, and you've just grounded yourself. And finally, if needed, pursue treatment, right? I mean, obviously, I'm a therapist. I believe in therapy. Choose a therapist who is someone who understands trauma or life-threatening medical conditions. I think that that's key. Talk to your doctors about medication that can ease symptoms. We have loads of support groups, tons for cancer and for survivorship, but the behavioral health department has also been playing around with different pandemic support groups. And even if we don't have what you need, I've found them out there, and we can direct you. See specialists that can help with some of those issues that I mentioned earlier that you may not be talking about quite as often, like sexual dysfunction, any sort of physical discomfort that you continue to have. You're going to hear in the future from our nutritionist. So what kind of diet should I follow now that I'm a cancer survivor? So use your MDs. And finally, self-help. There are so many great books, memoirs out there from cancer survivors, and what they've been through. There are organizations, podcasts, conferences. Find the Facebook page that you most relate to. So for me, I belong to a Facebook page of young breast cancer survivors. And still to this day, I use that page all the time. It helps me to hear what people are asking about. Sometimes I go out and I ask a question, and it feels like a community to me that I can get some really helpful, quick information from. So I'll end with a quote. The most resilient people on earth are people with cancer, because they are masters at adjusting to unwanted realities and uncertainty from the moment of diagnosis. People with cancer have looked death in the eye and are still finding their way, said by Dr. Shelley Johns. So I have complete and utter faith that if anyone can get through a pandemic effectively, it's definitely a cancer patient. So hopefully some of this was helpful, and I think we're going to open this up to questions.
So, Dr. Nicole, I would just like to say thank you. That was a really wonderful, wonderful talk. Can I actually ask a question?
Absolutely.
So, you and I have talked about this a little bit, but we hear about this whole issue about Zoom fatigue. You know, we're in endless meetings for work. We have family gatherings where it's kind of, you know, everybody's talking and trying to interact with one another. We're doing teaching school, you know, school classes are being taught online, and everything now is going to this whole virtual platform. How can we overcome Zoom fatigue? What can we do to help that?
It's a struggle, I can tell you, as a therapist and as a manager. All of my work at this point is done on a computer, which is a change, right? I used to be able to, you know, give people a hug once in a while, and I can't do that anymore. So I think we have to be creative. So some of the things that come to mind for me is, first of all, scheduling. Think about how you best work, and if it's possible, if you have the control to space things out in a certain way so that you're not sitting in front of the computer screen all day. Interestingly enough, some other patients have told me that if they work, they try to schedule all of their meetings on one day so they know for the rest of the week they really get a break. I think now that the weather is really beautiful, use this time that you have to do outdoor socially distanced things. See people if you can, that maybe you've been doing Zooms with before. I know for me, I've had some of the people that report to me come and meet, and we socially distance on my porch, but it gives us an opportunity to still see one another. And I think also there's decisions, right? If things are voluntary and you can decide to either pass on them, or even in terms of a webinar like this, we're recording this, you know, so I'm sure there were some people out there that thought to themselves, wow, I will have been on Zoom all day long. I don't know if I can do a program at night, but they might be willing to watch it over the weekend. So, you know, really think about your time so that you have a really good mix, and that this isn't what you're doing straight through. And by the way, I think there's a lot of advice out there from eye doctors. There was something in the Star Ledger just over the weekend. So look up what the eye doctors tell you to do as well, because there are exercises you're supposed to be doing with your eyes to help with this.
So one of the things I hear from a lot of patients, and especially some of my elderly patients or patients who live alone, is that they're feeling very isolated and cut off from their family and friends, you know, because of the pandemic. And what they really are craving is that human touch, which no matter what you do, it's somewhat hard to really be able to achieve in this, you know, at this point in time. So what techniques would you recommend for somebody, especially somebody who is perhaps living alone, who isn't able to see their children, their grandchildren, you know, their significant others because of, you know, work-related issues or whatever? What would you recommend to help cope with this?
We need to find ways to experience that same joy that you get when you hug somebody, and it's really hard these days to do so. You know, certainly people have gotten quite creative about it, but again, if the weather is good and you can get out and be in people's presence safely, of course I'm going to really encourage that. But you know, go ahead and give yourself a hug. I know that that sounds really bizarre, but wrap yourself in a blanket. You know, really, when you're either meditating or, you know, you're just having your cozy cup of coffee, I mean, try and give yourself a hug temporarily. Believe it or not, it is kind of comforting. I was at a function last week where we were saying goodbye to a colleague, and it was a bunch of therapists that went to somebody's house, and we did this, of course, on a deck, and we were all socially distanced, but we couldn't all hug each other, and it was really painful. But what we found that we were doing was going like, oh, like that, almost as if you're hugging someone, but you're not. And we've actually found some relief in that. And of course, the people that are in your home, I mean, if you do have access to people, it's harder, of course, if you're living alone. But gosh, hug those people that you can hug, even those people that maybe on an average day you wouldn't have hugged quite so much in the past. But We need to try. I think that's one of the biggest struggles and one of the sadness pieces that we talk about, because there's not a whole lot of ways around this other than to believe we will get there. We will get back to that place where we can do it again. And I love the chief of behavioral health gave us a strategy at the beginning of the pandemic and coaching patients to say, for today, or just for right now. So think to yourself, I can't hug somebody just for right now. May help you feel a little bit better in the moment.
We actually have a question from one of our attendees. So one of our attendees would like to know, when are you actually considered a survivor?
Well, so I would like Dr. Gibbon to give her opinion first. I certainly have mine, and I think many survivors do different things. But Dr. Gibbon, what do you like to say?
I like to say that somebody is really a survivor from the day that they are diagnosed moving forward, because I think that every step of your journey is a survivorship. And as you move from a treatment or a therapy or from a surgery or just the initial news, you are surviving each step of the way. And I think that, to define a specific time in my mind isn't appropriate. So I really tell people that somebody's a survivor from the beginning moving forward.
That's how I personally think of it. My diagnosis date was October 23rd, so that's the date that I use. Running support groups, though, for many years, I've seen people choose their surgery day because that's the day that the cancer, in theory, was plucked out of them. I've seen people use like the start of their radiation or their chemotherapy. Maybe they didn't have surgery, but that's the way in which they're going to approach their cancer. And I think if you look in the literature, there are many different versions of it. And I think it's whatever you want to grab onto that means the most to you.
So one of the other participants actually really appreciated your advice regarding worry time and thought that it was brilliant to kind of compartmentalize and separate that out and make it a special time of the day.
And it's something that we've started using not just for worry. I recently saw someplace that it was being suggested for grief, that if you've lost a loved one and you get through the basic time of quote unquote normal grieving, I mean, not like there's really necessarily a normal time, but the first couple of months, and you really feel like you're struggling to go back to work and re-engage in life, that you can even grieve your loved one in a special way by setting aside 15 minutes or 30 minutes that you're thinking of them. Maybe you're writing to them, maybe you're lighting a candle. And I was like, wow, right, we can decide when we want to have a negative emotional experience by just making a list through the day of all of the things that we want to tackle and handle, and then put it in a compartment. And I like to say, then close the book, right? And then you're free. You're free of that negative emotion until tomorrow, which doesn't mean that it won't sink in. It will sink in, but you'll remind yourself, oh, I do that tonight at 7 o'clock. And it's that easy to dismiss it sometimes.
I think that's good advice for everybody, regardless of what's going on, quite honestly.
For sure.
Several patients have actually shared with me that they have this sense of hopelessness, that the time that they have, left is being negatively impacted by COVID and preventing them from living their life to the fullest. How would you respond to this? How would you help somebody work through that?
I understand it. I particularly understand it in my patients that are a little older, that may feel like time is passing by and we haven't been able to spend it with our loved ones or really doing the things that we love doing. I'm going to refer you back to that idea of values. because I think there's lots of things that you'll find on that list that you maybe haven't thought about as carefully that you really value in your life. And then even if we're stuck at home, and even if we're not able to, go out and have the celebrations that we used to, or engage in the activities we used to, how can we get creative about the time that we do have to still make it meaningful? Because, hey, I mean, I've worked with patients who have severely limiting health conditions. One or two patients over the years had, macular degeneration really badly, and were actually going to lose their sight. And as a result of losing their sight, there were lots of things that were going to be taken away from them. But we worked really quickly to think about, well, what are the things then that we need to have in place to still make them feel like the next 20 years of their lives are worthwhile? So it requires work, it requires creativity, but I also think it's like developing a toolkit. We just keep throwing a lot of things up at the ceiling, and we monitor how we feel. And actually, that's something I didn't mention tonight, but I think it's an easy thing any one of us could do, is between 1 and 10, what's our mood? Right? With 10 being the best you can feel, and 0 or 1 being the worst you could feel. So what's your mood? Right? We'll just use a general word like mood. Let's say it's a 2. If you call a friend, when you get off the phone, ask yourself, what's my mood right now? If your mood has at least increased by 2 points or more, that's an item that should go in your toolkit. So I think in this case, what we're going to be looking for is, if we're missing out on time in one corner of our lives, how can we still pursue things, maybe things that weren't even on our agenda, like, oh, I'd like to, learn a language, or I'd like to play this piano that's been sitting here for 40 years, but I forgot how, and still feel like we're adding value and that our life is worth living. So if you're struggling, just keep looking. And if one of us therapists can help you, please, by all means, access us to help you figure out what some of those things could be.
Excellent advice. So I'm not sure if there are any other questions. Elise, am I following the chat room properly, or?
Yes, I just sent a quick note to see if there's any more questions.
Well, while we're waiting to see if there's any more questions, I would just really like to thank both Dr. Nicole for a wonderful presentation today. Thank you. And also I'd like to thank Elise Taloni, who has put an incredible amount of work into arranging these, virtual sessions for us, and has always been there helping us ever since we started this Surviving and Thriving series 4 years ago. And it's hard to believe that it's been 4 years already. This is our first virtual one, and hopefully next year we'll be able to do it in person again. But it doesn't appear that there are any other questions. So I just want to thank you all for joining us tonight. We look forward to presenting part 2 of this series on Wednesday, October 21st at 7 o'clock at night. You can register on our website and to join us for a live cooking demonstration with Jean Petrucci of Living Plate, who will teach about nutrition for optimal immunity. And please look out for the short survey that will appear in your browser as you exit this session. And I thank you in advance for taking the time to fill it out. And thank you, everybody. I hope you enjoyed this as much as I do, and I look forward to seeing you at our next event in October. Have a good night, and everybody stay well.
Bye, everyone. Thanks.